So hello friends, hi, good morning. Good to have you with us. I'm home. I hope I'm audible and visible to you properly. Right. So just give me a thumbs up if at all I'm audible and visible to you properly. Just give me a thumbs up, guys. So hi Aisha, good morning. I'm really sorry for a bit of a delay on my side. I'm really sorry for that. So thank you so much for joining, all of you guys. Just give me a thumbs up. Good morning. Hi Maya, good morning. Right. So good to have you all on the morning of after the NEET PG exams. Right. So let us begin our today's session. Today we are here to talk about again some AIIMS kind of a question which we covered kind of yesterday. So on the similar terms we'll be talking about things today. Right. So let us begin with the session. Is it? Okay. So let us begin with the session and gradually and slowly we will be talking about your further course of action and everything. So let us begin with our session. So the first kind of a question in today is, what is the first kind of a question? Right. So the first question is, CECT is the investigation of choice for the angiomyolipoma, and the reason which is given over here is angiomyolipoma can present with a retroperitoneal hemorrhage. So what is the thing? Like, is the assertion true? Is the reason true? And is the reason the correct statement for the assertion? Can you please guide me with this? What do you think about this? Is CECT the investigation of choice for angiomyolipoma? Yes or no, guys? Can you please tell me that? Um, yeah, so please respond on the comment box. What do you think about this? Yeah, I'm waiting for your response, guys. What do you think? Is kind of CCT's investigation of choice for angiomyolipoma? Yeah, so the answer you are giving is both A and assertion and reason are correct. Okay, so Maya is saying the answer is C. Well, yes, but is the reason a correct answer, reason for the assertion? No, it is not the correct reason for the assertion. So Indriani, good to have you. Good morning. Right. So CCT is the investigation of choice for angiomyolipoma. It is a true statement. Okay. So it is a true statement. Okay. What exactly is the angiomyolipoma? So angiomyolipoma is a kind of a condition in which it is a benign tumor of a kidney, in which what do you have? It is basically consisting of angio, that is the blood vessels, then myo, it means that the muscle layer, and the lipoma means that it has a fat. So it has all the three components in it. It has the blood vessels, it has the muscle layer, it has the fat. So it is a benign tumor consisting of all the three conditions. Okay, so this is angiomyolipoma. Now, right. So angiomyolipoma can present with a retroperitoneal hemorrhage. Is this the true statement? Yes, it is also a true statement. Now, if at all this happens, if at all this kind of a thing happens, what do you think? Like, what is it called as? Do you know any syndrome which is called, like, what do you call it? What is this particular condition known as, that angiomyolipoma presenting with a massive retroperitoneal hemorrhage? What is it called as? Can you please tell me what is it called as? There's the one syndrome which is named after this. So I'm here to kind of stress on your brain so that you kind of remember this particular things, because I'm sure all of you must have read angiomyolipoma at one point or the other. So can you please tell me? Please put it up in the comment box. Yeah. So what is the name of the syndrome? Anybody, guys? Can you please tell me? So the name of the syndrome is, in fact, it is a Wunderlich syndrome. Okay, so what is it called as? It is called as a Wunderlich syndrome. So what happens in this? This is basically a syndrome in which you have a massive retroperitoneal hemorrhage because of the angiomyolipoma. Why do we get a massive retroperitoneal hemorrhage? Because this is a tumor consisting of the angio, that is the blood vessels. So what happens in the angiomyolipoma is that the blood vessels become very tortuous and dilated, and because of this they may rupture and bleed, and if at all they bleed, what will happen? There will be a massive retroperitoneal hemorrhage. So these patients can present to you as a hemodynamic instability in the state of a shock. So patient of angiomyolipoma who is kind of asymptomatic, because usually the angiomyolipoma is by far asymptomatic. Okay, it is an incidental finding, but they may sometimes present to you with an hemodynamic instability if at all they develop this retroperitoneal hemorrhage, the massive retroperitoneal hemorrhage. Okay, so yes, Hema, you're absolutely correct. It is in Wunderlich syndrome. Now, another important thing with this is, what about the calcification? Do you get calcification in angiomolipoma? Do you get any calcification in the angiomolipoma? So please understand, if you do a CT scan in the angiomolipoma, calcification is characteristically absent. Okay, so calcification is characteristically absent. And what is about the fat density? Because it has a fat inside it, so the characteristic fat density which we get in the angiomolipoma is, it is negative 20 Hounsfield unit. Okay, so minus 20 Hounsfield unit is the fat density which you get in this. Okay, so angiomolipoma patient, calcification is absent. On the CCT, what you get minus 20 Hounsfield unit as a fat density, and this is a kind of diagnostic thing. And because of this reason, the investigation of choice for the angiomolipoma is CECT. Are you understanding? So in the CECT, calcification is absent. We have minus 20 Hounsfield unit, and the patient may present as a massive retrobuttal hemorrhage. The answer is in fact B. So the reason why the contrast enhanced CT scan is the investigation of choice, this is because on the CECT we get a minus 20 Hounsfield unit, which is for the fat, and it is a kind of a diagnostic feature for angiomolipoma. I hope you got it. Okay, right. Moving on. So the next question is this. So here we have on this particular thing, what you have a characteristic IVU appearances, and here you have some diseases of, or the congenital anomalies of the kidney. So if you want to match these, what do you think? What is the correct match? So where do you get this adder head appearance? A very simple one. Where do you get the adder head appearance? Can you please tell me? I'm waiting for you guys. Where do you get this adder head appearance? So what is one? A is matched with. Can you please tell me what's the answer for A? I'm waiting for your responses, guys. So good to have you. Good to have all of you with me. All the 13 of you who are joining with me at this moment. Right. A is with 5. So Maya is saying A is with 5. Indrayani is saying A is with 5. Absolutely correct. So adder head appearance is something which you get with uretrocele. So what is the other name for adder head appearance? It is also referred to as. A cobra head appearance. Okay. So yes, it is also referred to as a cobra head appearance. Okay, so adder head or a cobra head appearance, this is what is you get in uretrocele on intravenous urography. Now let us talk about this fishhook appearance. Where do you get this fishhook appearance? Can you please tell me? So where do you get this fishhook appearance? Can you please tell me? Yeah, what about B, guys? Let us first talk about B, then we'll move on to C and D. So where do you get this fishhook appearance? So B, Indrani is saying that B is 1. Okay, well in fact B is for 1, that is retrocable ureter. Yes, B is matched with 1, that is a retrocable ureter. Please understand. So fishhook appearance, this is matched with 1, that is a retrocable ureter. So what is a retrocable ureter? Ureter ideally goes in front of the inferior vena cava, but if at all it goes behind the inferior vena cava, it is called as a retrocable ureter. As simple as that. Now, what about this bristles of brush appearance? Now this is something which is important. So where do you get this bristles of brush appearance? Can you please tell me? Where do you get this bristles of brush appearance? Can you guys please tell me where do you get this? So Indrani has already said that we get this in 2, that is a medullary sponge kidney. What do you think is the answer, guys? So yes, in fact, this bristles of brush appearance, you get this in the medullary sponge kidney. So bristles of brush appearance, it is present in the medullary sponge kidney. So what happens over here? You have this kind of a renal pyramid. This is your kind of thing. So what happens is, from here you get a bristles of brush appearance like this. So if you go for a intravenous urography, you do get kind of a hyper intense bristles kind of appearance, and this is what is called as the bristles of the brush appearance, and this is a characteristic IVU finding of medullary sponge kidney. Please understand this. Now lastly, let us talk about this striated nephrogram. Now nobody has answered this correctly. So some of you have said that it is present in the ADPKD. Is it true? Where do you get this striated nephrogram? Can you please tell me? Any inputs on this, guys? Where do you get this D? So you are saying that D is with 3, Maya. Maya, you are not. This is not correct, okay? So D is not with 3. Can you please tell me? So striated nephrogram, this is a characteristic finding which you get in the patients with the autosomal recessive polycystic kidney disease. This is not present in the autosomal dominant polycystic kidney disease. Please understand this. In the autosomal dominant polycystic kidney disease, what do you get? You get a spider leg appearance. Okay, so here you get the characteristic spider leg appearance. But in the ARPKD, what do you get? You get a striated nephrogram. So there's a difference, okay? So on the ADPKD, what do you get? You get a spider leg appearance. In this ARPKD, what do you get? You get a striated nephrogram, okay? Well, yes, it's not sixth, okay? Striated nephrogram is also not present in the sixth. What do you get in the sixth? What do you get in the sixth? In the duplication of ureter, what is the characteristic finding which you get? So in the duplication of ureter, you can have a, what can you have? Can you please tell me what can you have in the duplication of ureter? You can have a drooping lily sign. Okay, you can have a drooping lily sign. So this is a kind of thing which you get in the duplication of ureter. So drooping lily sign is associated with the duplication of ureter, right? So yeah, these are basically the IVU findings which are correlated with the congenital anomalies of the kidney. I hope you understood it, right? Okay, yeah, it's a drooping lily sign. It's not a water lily sign, it's a drooping lily sign. Please understand. Water lily is associated with hydrated cyst. Okay, Shankar. So yeah, water lily is associated with kind of hydrated cyst, ruptured hydrated cyst, but drooping lily sign is associated with the duplication of ureter. Please understand this. Right. So this is all about the congenital anomalies which I wanted to talk to you about. And yeah, moving on. So the true statement about the bladder stone is all of the following except. So which of the following is true statement about the bladder stone except? So primary bladder stones are more common in elderly. Is it true? What about the first statement? Is it true or false? So primary bladder stones is more common in elderly. Is it true or false? Can you please tell me? So Imran, good to have you. Good morning. Yeah. So primary bladder stone, it is more common in elderly. Is it true or false? What do you think? Primary bladder stone, is it true or false? What do you think? Can you please guide me with this? What do you think is the answer for the primary bladder stone? Please respond fast, guys. Yes, very good. It is in fact a false statement. What about this? Secondary bladder stone is associated more common in children. This is, what is this? This is also a false statement. Please understand. So secondary bladder stone is more common in children. This is also a false statement. Okay, right. Then what about this? Bladder stone in children is more common than males. So if at all there is a bladder stone occurring in the children, it is more common in males. So is it more common in males or in females? What do you think? What should be the answer over here? So what about the option number C? What is the answer? Is it true or false? So this is a true statement. If at all there is a bladder stone occurring in the children, it is more common in males as compared to the females. Please understand this. Okay, right. Okay. Now, what about the option number D? The patients with the bladder stone present with terminal hematuria. So do the bladder stone patients present with terminal hematuria? Is it true or false? What about D, guys? What about D? A bladder stone presents with terminal hematuria. This is again a true statement. Okay, so clinical feature of a bladder stone that it presents with a terminal hematuria. Right. Then what about D? 10% of the bladder stones are radiopaque. Is it a true statement or it's a false statement? So it is a false statement. Okay, so 10% of the bladder stones are radiopaque. It is a false statement. Why it is a false statement? No, D is a true statement. Okay, and E is a false statement. Why? Because not 10%, around 80% of the bladder stones are the ones which are radiopaque. Please understand, 80% of the bladder stones are radiopaque and all the other statements are false, false, true, true, false. Okay, I hope you understood it. Right, so let us have a look about the bladder calculi. So the basic difference between the primary bladder calculi and the secondary bladder calculi is that primary bladder calculi is not associated with any distal obstruction, but a secondary bladder calculi is the one which is associated with one or the other distal obstruction. Are you understanding? So primary bladder calculi, it is not associated with any form of distal obstruction, but a secondary bladder calculi is the one which is associated with bladder obstruction or for a distal obstruction, right? Now, let us first talk about the primary bladder calculi. So primary bladder calculi, it is much more common in males as compared to the females. Okay, so this is a fact which you need to remember, and it is more common in children who are less than 10 years of age. Why? Because this is associated with the diet. So in these children, what is happening? Their diet is kind of deficient in the phosphate, and basically it is a cereal deficient diet, and because of this the patients land up into primary bladder calculi. Now another important MCQ related to the primary bladder calculi is that the most common type of stone occurring in the primary bladder calculi is the ammonium urate stone. Please understand. So the most common type of stone is the ammonium urate stone. And if what about the recurrence? If at all you have treated this primary bladder calculi, what about the recurrence? Will the recurrence occur? The recurrence will not occur. Okay, so recurrence will not occur. So why recurrence will not occur? Because as we saw that it is more common in the children less than 10 years of age, and if at all you treat this particular condition over a period of time, what will happen? Over a period of time, the child will overgrow this particular age and he will improve on his diet. And because he improves on his diet, what will happen? The recurrence is uncommon with the primary bladder calculi. Now, Ravi is asking, what does the primary mean? So primary basically means that it is caused because inside the urinary bladder itself, it started its development in the urinary bladder itself. So please understand the basic difference between primary and secondary is that in the primary you don't have any form of distal obstruction. I will talk about secondary, but primary, if at all the stone is formed and there is no distal obstruction, then you will refer to as a primary bladder calculi. Hope you understood. So these are all the features about the primary bladder calculi. Now let us talk about the secondary bladder calculi. Now what happens in the secondary bladder calculi? This is formed because some or the other distal obstruction. So what do you understand by the distal obstruction? Let's say the patient is having the BPH. Let's say the patient is having urethral stricture. Okay, so there is a urethral stricture, or there is, due to any reason, if at all there is any kind of a distal obstruction, and in the presence of a distal obstruction there is a formation of a bladder calculi, you refer to it as a secondary bladder calculi. Now what do you think? Who are the patients who will be more suffering with any kind of a distal obstruction? So elderly patients are the ones who are more associated with one or the other form of distal obstruction. So all these BPH, this urethral stricture, this is more common in the elderly. So that is why elderly is associated with the secondary bladder calculi. Then what about the type of stone? So the most common type of a stone in the secondary bladder calculi is the uric acid. So uric acid is much more common in the secondary bladder calculi. And if at all you treat this particular condition, what about the recurrence? So recurrence is common in the secondary bladder calculi. Why is the recurrence common? Because what is the cause? BPH or the urethral stricture. So if at all there is an elderly patient, and even if you treat this particular patient for the bladder calculi, there is a high chance that the recurrence might take place, because the primary pathology, that is the BPH, the urethral stricture, might still persist and the patient may develop this particular secondary bladder calculi. Okay, so please understand this is also an MCQ point. The recurrence is common in the secondary bladder calculi. It is not common in the primary bladder calculi. So how will the patient present to you? Patient will present to you with something which is called as a terminal hematuria. What do you understand by the terminal hematuria? Okay, so if at all any patient is having a terminal hematuria, it indicates that the patient is having a pathology in the posterior urethra or the bladder neck. So this terminal hematuria is not kind of a characteristic finding of the bladder calculi. If at all the patient has a terminal hematuria, the only thing which it signifies is that there is some or the other pathology in the posterior urethra or the bladder neck. This is what is being characterized by this. And what about the diagnosis? You go for USG. And what about the treatment? If at all it is a less than 2 centimeter stone, we go for cystolitholapexy, which is basically a cystoscopic guided treatment. And if at all it is more than 2 centimeters, we go for open cystolithotomy. Okay, so this is all about the bladder calculi. It is a very important topic, so that's why I decided to cover it in detail. Please understand kind of the primary bladder calculi, it doesn't recur, but the secondary bladder calculi, the recurrence chances are more. And if at all the size of the calculi is less than 2 centimeters, you can go for the cystolitholapexy. And if at all the size of the calculi is more than 2 centimeters, you can go for open cystolithotomy. So I hope you kind of like this video. And if at all you have any doubts, please do ask me. Any doubts? Any doubts if you have, you can please feel free to ask me. I'll be more than happy to guide you over this. And if at all not, I'll just take up a couple of minutes and explaining you how the Unacademy works. So this was basically a part of the free session which we are conducting as a part of Unacademy in order to increase the awareness about the Unacademy platform. So what is Unacademy? Unacademy is basically the new sessions which we have started. So we have started just in the recent October. And before the NEET 2019, we covered a medical marathon in which we got a really good response, and some of the students really did get benefited in the NEET PG. Now we have already started with our courses for the upcoming NEET 2021. The only reason why I'm talking about this is what I'm talking about this particular thing is that I want to spread the awareness and tell you how does Unacademy works. Now, before doing this, I just addressed to a question of Prithvi. Prithvi is saying, what is cystolitholapexy? So please understand, what is cystolitholapexy? Cystolitholapexy is a cystoscopic treatment. So what exactly you do in here? You take up a cystoscope, you enter inside the urinary bladder, and inside the urinary bladder, if you have a, let's say a kind of a stone. So with the help of an instrument, what you do, you catch hold of this stone and you crush the stone. So this particular big stone is broken down into the small stones, and this can be washed out into the urine. So this is basically without operating on the patient, you can get rid of a urinary bladder stone, but this can be done if at all the size of the stone is less than 2 centimeters. So this is what you understand by the cystolitholapexy. Okay. I hope you got your answer, Prithvi. Okay. Yeah. Okay, so let's move on and let's just talk a bit about Unacademy. So how exactly Unacademy works? So this was a part of the free special class which you just attended. So we do free special classes on the Unacademy platform and as well as on the YouTube. You can feel free to attend it even without paying anything. It's completely free of cost, and it is going to be the free of cost for the entire year. So you can attend it anytime you want. Another thing, all these are the part of the plus subscription. So what is all included in the plus subscription? We have the batch courses, we have the foundation course, we have the AIIMS and PGI targeted courses. Then we are coming up with the test series and the Q bank, and there are the structured notes. And finally, after August, it is basically kind of a crash course which we'll be launching. That is the medical marathon. So let us have a look at it. So what is a batch course? So batch course is basically a course in which all the educators come on subsequent days and they cover it. So this is basically the foundation course for the NEET PG 2021 which we have launched. It is basically the main course for the NEET PG 2021, and this will be kind of continuing for a prolonged period of time. It will get completed by the August or September, and this is the main course for the NEET 2021. I will be taking your general surgery in here. So surgery in the foundation course will be taken up by me, and I will cover the entire general surgery in 120 hours. So I'll be discussing MCQs, I'll be discussing important topics, everything will be covered in this particular course. Now, for NIMANS, we have come up with this integrated batch course for the NIMANS exam. You can feel free to attend it. This is coming up very soon. It has already started on 29th of January. Okay, right. So this is about the batch course. Now I'll just take up a question. A student has asked me a question. I'll just take it up. So Ravi saying, मेरे friend ने Unacademy subscription लिया है, but he said that एक साथ many classes at the same time कैसे manage करें? Right. So please understand, Ravi, I do understand your point that there are multiple classes which are going at the same time. But please understand, you don't need to attend each and every class. Please understand this particular point. So what exactly happens in this is, for example, if you are targeting for the NEET 2021, so your primary target is for the NEET 2021. If at all you join, if you follow this foundation course, none of the classes in this foundation course will overlap. None of the classes. For example, Anat, Physio, Biochem, Surgery, Medicine, none of the classes in this foundation course will overlap. But this foundation course can overlap with other kind of classes. That's completely fine, because it is practically impossible. Because see, understand, most of the students are kind of busy from morning till evening, and we have to take up the classes after evening only, because that is the time when the students will be free. So what we have decided is, if at all there is a one course, for example, a batch course for NEET 2021, none of the classes will get overlapped. But at the same time, educators will keep on taking up the individual small courses, they will be keeping on launching it. So if at all any student is finding it difficult to follow that particular subject in the foundation course, they can visit those classes later on, and those classes will also be available in the kind of a recorded format. So you can attend the foundation course live, and the other classes you may attend or you may decide to attend as a recorded format as and when suited, if at all you find the need of it. So please understand, you don't have to kind of attend each and every class. You just wish to attend the classes which you find beneficial, which you are weak in. For example, in the general surgery, if you are very thorough in urology, you may skip the classes of urology. But if you are kind of having a difficulty in hepatobiliary system, you can come and attend that particular class. Okay, so that is a kind of a crux. See, basically it is like a YouTube of medicine. So you will have all the different kind of courses. You will have targeted course for the NEET, you will have targeted course for the NEET PG 2021. Then there is a capsule courses for the AIIMS which we are launching. So depending on what level of preparation do you have, you can follow different courses. I hope I made my point. So if at all you are someone who is targeted to prepare for the NEET 2021, you can just follow this foundation course and you can actually go on the site and check it. None of the classes on this particular batch course will overlap. And at Physiobachem, none of the classes will overlap. Okay, so the classes have already started from 27th of January, and the classes will be conducted 3 years daily from 9 to 10:30, then 10:30 to 11 will be the break, and from 11 to 12:30 there will be a second session. So every day 3 years of classes, and if at all anatomy starts, it will continue for 7 days. If at all biochemistry starts, it will continue for 7 days, so that even the students have a link and even the educators have a link. Okay, so I hope you get it. So this is about the batch, kind of the batch course which I talked about. At the same time, the individual courses which I was talking about, so these individual courses are being launched by different educators. For example, I've just finished up with my urology course, which I launched on January 21st. So what happens, if at all you want to attend it, you can attend it. If at all you want to attend it in a recorded format, you can attend it later. But it is all up to you. What we are trying to do is, we are just trying to provide you with all these things, and you can decide for yourself what works best for you. I completely understand it is a bit confusing, and all such videos coming up, you might find it a bit difficult what to follow, what not to follow. But please understand, the basis of all these things is that you have to follow one particular batch course for the NEET 2021, and then additionally, if you want to attend any of these kind of individual courses which we will keep on launching over a period of time. For example, we will be launching, for example, I am coming up with the MCQ discussion kind of a course for kind of hepatobiliary system and the GIT and everything. So let's say you have attended a kind of a surgery and you just want to revise the general surgery, or you want to revise the GIT, you can just have a look at the recorded format of the MCQ discussion kind of a thing. That will help you out. Okay, so I hope I made my point. I hope you got it. Okay, so you are basically wanting to focus for the May exams and you're a post-intern. So yes, you can definitely try to attend these particular detailed courses of urology for the AIIMS and PGI launched by me. But again, these individual courses might overlap. So yeah, I mean, see, understand. So you can attend few of the educators live, and the other educators you can attend in the recorded format. The difference is in the app-based recorded lectures, what will happen? They are basically teaching to the camera, so the kind of the classes are not that interactive. But here, even in the recorded format, we are actually interacting with the students. The students will ask us the doubt, we will answer them. So more likely that the doubts which you will have will be the same doubts the other student might have. So the recorded format of our classes will also be a bit more interactive than the other app-based recorded lectures. So you can definitely do that. And if at all you have any doubt, we will be practically coming live each and every day. So you can join us anytime and you can ask your doubt and you can get it clear. That's completely fine. I hope I made my point. So this was only thing which I wanted to talk to you about. So please understand this particular thing. There's a batch course for the NEET 2021, and then there is a foundation course for this particular thing. This is foundation course, that is for NEET 2021. For the AIIMS and PGI, till now, we have launched the individual courses. There is no batch course for the AIIMS and PGI, but yes, yeah. And then what about the test series and the Q bank? They are under the process. They will be live very, very soon. Within 1 month, you will have the test series and the Q bank, which will be live on the platform. And we are also working on the structured notes. And once the course is completed by the August or something, we will be coming up with the medical marathon, which we came up last year also. So it is basically kind of a crash course which we conducted just before the NEET PG, and this will definitely help you out. So if at all you take up a year-long subscription, which is being offered at this moment at 22.5K. So if you take up a year-long subscription, you will have an unlimited access to all these things, like all the videos, all the test series, all the Q bank, all the structured notes, and even the medical marathon. You will have an unlimited access to all the videos uploaded on the platform year-long. If at all you take up a year-long subscription, 22.5k, if at all you use the promo code dr.pawan. If you use this promo code, you will have an unlimited access to all these things in 22.5k year-long subscription. 6-month subscription is being offered at 18k. So it is actually 20k. If you use the promo code, you will have 10% discount, and the original price is 25k. If you use the promo code, you will have 10% discount. Okay. So yes, this is how you might do it. So I'm not trying to tell you here that, just come and join Unacademy. That is the best thing ever. I'm not trying to do that. What I'm trying to do is I'm just trying to increase your awareness about Unacademy, because we are doing our best, and you can actually go and visit my page. The link will be in the description box. You can just go in there. You can have a look at all the courses which I have launched. You can have a look at the dedications which the students have given me for the kind of teaching and everything. And you can also look at the upcoming courses, and you can have a look at it. You can attend a few of the special classes on the app, so that you will have the actual feel how exactly the classes are conducted, because these are the YouTube sessions. If you come on the app, you will have the feel of the actual classes. And if you join it, we will be more than happy to guide you through the entire year. So batch and the foundation course. So see, understand, batch courses are many batch courses. For example, there is a batch course for NIMHANS. Then there is a batch course for the NEET 2021. So foundation course is basically the batch course for the NEET 2021, but this I just mentioned to you differently, but this is just one of the batch courses which we have launched. Over a period of time, we will be launching many batch courses over the subsequent period. Please understand this. So this is the first batch course which we have launched over a period of time, and we are also planning to launch a batch course for the November AIIMS and PGI. So yes, after June, the batch course will start even for the November AIIMS and PGI. Right, so the difference between the batch and the foundation course is that there will be multiple batch courses, and foundation course is one of the batch courses. Okay, so yes, this is all about the Unacademy which I wanted to share with you. So yes, what I was trying to tell you is you can go on the page, you can have a look at the actual lectures, you can have a look at the dedications, and we are committed to it. We are trying our best, and we'll be more than happy to connect with most of you. But again, I completely get it. I'm not trying to say you that just come and join it. I'm not trying to say you that. I'm trying to say you that if at all you want help, we are here to help you out, and I'm just trying to make you understand how our platform works. That's it. Okay, so thank you so much for joining with me, guys, and it was indeed a pleasure interacting with you. Right, so sir, what is the future schedule of right, so see, understand, Indrajit, I have already covered my urology session. My hepatobiliary is kind of progressing, and from 10th of February I will be launching the session on the general surgery. Then subsequently I'll be launching the session on the GIT, then cardiovascular thoracic system, and before AIIMS and PGI I plan to cover all the individual courses. And just before AIIMS and PGI, I will be launching, for example, in mid-April or something, I will be launching a rapid revision course in general surgery, in which I will be revising the entire general surgery in 20 or 24 hours around. So in 24 hours, I will be revising the entire general surgery. So this will be an individual course launched by me just before the AIIMS. So if you attend that 24 hours general surgery session, entire general surgery I'll be revising. And before that, I will be having multiple small courses, and I am planning to conduct them in an MCQ pattern, because I completely get it. You guys have prepared for the NEET PG, so you have gone through the theory. Now what is needed is MCQ practice. So I will put up all the MCQs, and you can have a look at the individual courses. Okay, so yes, I'll definitely be launching that. And if at all you decide to join, please try to use this promo code dr.pawan. It will be a bit helpful for me. Okay, so thank you so much, guys. If you have any doubts, please do ask me. I'll be more than happy to guide you. And thank you so much for interacting with me. It was indeed a pleasure. Right. Right. Thank you so much, guys. It was indeed a pleasure interacting with you. Have a great day. Bye. Happy studying. See ya. Okay, so where is the schedule available? So with okay, so where is the schedule available? See, understand, Indrajit, if you go on my particular page, The upcoming courses are not yet launched because of I had some family issues at this particular moment, so I was not able to launch them, but it will be launched very soon. Please understand, if you go on my page, the link will be in the description box. If you just go on the page, if you click on the courses, there are all the courses, then there are the completed courses, and there is an ongoing courses. The upcoming courses at this moment, it will be empty. I'm really sorry, it is a kind of fault on my side. I forgot, I couldn't launch them. It is in the process, it is going to be launched, but please take it from me. I'm assuring you. See, the courses till June will not be available. Subsequently, I will be launching them, but I have definitely planned them. So for the coming month, that is February, I assure you that from 10th or from 12th of February or somewhere, the course, individual course on the general surgery, then the individual course on the GIT, all those things will be launched very soon. So it will be showing up in the upcoming courses. At this moment, if you go, it will show empty because it is a fault on my side. I couldn't launch them, but I assure you that it is going to be there very soon. In a couple of days, I will be launching it. Okay. I hope you got your answer. I want to join complete course for 2021. So yes, Ashish, I'll be very much happy if you join it. If at all you want to join it, please consider using my promo code, that is dr.pawan. So if you just go on kind of a thing, okay, so if you just go on the app, so the entire course at this moment will be showing as 25k, but once you click into that and if you use the promo code dr.pawan, the rate will reduce down to 22.5k. So in the entire year-long course, you will have the entire year-long course in 22.5k. So if at all you want to join, please do consider using my promo code, that is dr.pawan. It will help me a bit. Okay, so thank you so much, guys. If you have any doubts, you can feel free to kind of interact with me. You can directly message me on Unacademy platform. You can reach out to me on Facebook. My Facebook profile is Pawan Kandhari. Pawan Kandhari, Kandhari. You can just directly reach out to me. You can send me a message. I'll be replying you back. So thank you so much for joining with me. It was indeed a pleasure. Okay, so how to join? You just go on the app and you download the app, or you can go on the website. You can just go on the NEET PG section, click on the plus course. If you scroll down, you will have take subscription. So while taking the subscription, you can choose 1 year subscription, and then the course will be like the price will be 25k, and if you use the promo code, it will drop down to 22.5k. If you have any doubt related to Unacademy, I have shot 2 videos on the YouTube, that is all about Unacademy part 1 and all about Unacademy part 2. You can have a look at that. That will also help you in navigating the site through. Okay, and if you have any doubts, please do message me on the Facebook. I'll be more than happy. See, understand, if you take up a subscription, you will have unlimited access to all the videos uploaded by all the educators. Yes, definitely there is a course for AIIMS 2, AIIMS May 2. I have already launched the individual course on urology, hepatobiliary system, and each and every educator is doing the same thing. So yes, definitely even before AIIMS, you will have a lot of courses for you to revise. You will have that. Okay. So thank you so much. It was indeed a pleasure interacting with you guys. Please do consider joining this. Okay. Thank you so much. It was indeed a pleasure. Have a great day. Yeah, and today I have 2 more YouTube sessions at 11:30 and 12:30. I do have that, so please do consider kind of joining it. Okay, thank you so much. Bye.